ExamPrep.School. NC Medicare Supplement, yes, long-term care, insurance exam, exam code InsNC-MSLTC21. There are 6 practice exams in this series. This video covers Practice Exam 1. The first 20 questions are free. In this video, we will be covering the following major categories for Practice Exam 1. Long-term care policies, Medicaid, Medicare Part A, Medicare Part B, Medicare Part C, Medicare Part D, Medicare supplement policies, Medicare in general. Let's walk through the format. I'll read each question and its choices. Let's get started. Question 1. Which provision best articulates the fundamental role of Medicare within the federal social insurance system? A. Administering retirement pension benefits to eligible participants under an earned benefit structure. B. Providing income-based medical assistance to low-income individuals and families. C. Securing health insurance coverage for individuals aged 65 and older and certain disabled individuals through social insurance financing. D. Delivering public health and welfare services for children and expectant mothers under federal block grants. A countdown circle appears in the top right. Once it completes, the answer is revealed. You can pause at any time if you'd like longer to think. If you'd like additional practice covering more topics, see the description for our book. The correct answer is C. This option is correct because Medicare is a federally administered social insurance program that provides health coverage for those aged 65 and older and certain disabled individuals, funded by payroll taxes and general revenues. Reason A is not correct. This distractor is wrong because administering retirement pensions is the function of the Social Security program, not Medicare. Reason B is not correct. This distractor is wrong because Medicare is not a means-tested program based on income. Reason D is not correct. This distractor is wrong because public health and welfare services for children and expectant mothers are outside Medicare's scope. Question 2. Entitlement to premium-free Medicare. Part A is contingent upon which of the following Social Security criteria? A. Income falling below a specified threshold in the year before enrollment. B. Accumulation of sufficient Social Security work credits through payroll tax contributions. C. Approval from a state medical review board attesting to disability status. D. Enrollment in Social Security retirement benefits for a minimum of 12 months. The correct answer is B. This option is correct because premium-free Part A entitlement is based on earning a required number of work credits through payroll tax contributions, not on income level or retirement benefit enrollment. Reason A is not correct. This distractor is wrong because entitlement to premium-free Part A is not determined by income thresholds. Reason C is not correct. This distractor is wrong because no state medical board approval is required for Part A entitlement. Reason D is not correct. This distractor is wrong because enrollment duration and retirement benefits alone does not establish Part A entitlement. Question 3. A hospital finance director warns the board that the Medicare Hospital Insurance Trust Fund is projected to exhaust its reserves within the next decade. The director asks the board to identify which combination of revenue sources finances the Part A trust fund most accurately. Which of the following list contains only appropriate funding sources for the Medicare Hospital Insurance Trust Fund? A. Payroll taxes on covered earnings, interest on trust fund investments, premiums paid by self-employed individuals lacking sufficient work credits, and income taxes on Social Security benefits. B. General federal revenues, premiums paid by Medicare, Part B enrollees, state matching payments, and sales taxes levied by state governments. C. Payroll taxes on covered earnings, general fund appropriations, premiums for preventive services, and tobacco excise taxes. D. Deductible payments from beneficiaries, coinsurance collected under Parts B and D, interest penalties, and optional Medigap policy surcharges. The correct answer is A. The Medicare Hospital Insurance Trust Fund is financed primarily through payroll taxes on covered earnings, interest earned on trust fund securities, premiums paid by voluntary enrollees lacking sufficient work credits, and income taxes on Social Security benefits. Other revenue streams like general fund appropriations or Part B premiums do not feed into the Part A trust fund. Reason B is not correct. This list includes general revenues, Part B premiums, and state contributions, none of which fund the Part A trust fund. Reason C is not correct. General fund appropriations and preventive service premiums do not contribute to the Hospital Insurance Trust Fund. And reason D is not correct. Coinsurance from Parts B and D and Medigap surcharges are unrelated to Part A trust fund financing. Question 4. Which of the following correctly describes the timing and duration of the initial enrollment period for Medicare Part A and Part B relative to an individual's 65th birthday month? A. It begins 3 months before the birthday month, includes that month, and lasts 3 months after. B. It begins on the first day of the birthday month and lasts for 6 consecutive months. C. It commences 3 months after the birthday month and runs 3 months thereafter. D. It starts 3 months before the birthday month and ends 6 months after that month. The correct answer is A. The correct answer is that the initial enrollment period begins 3 months before an individual's 65th birthday month, includes that month, and extends for 3 months afterward, creating a 7-month window. Reason B is not correct. This description is incorrect because the period does not start on the birthday month and last exactly 6 months. Reason C is not correct. This option is inaccurate since the initial enrollment period does not begin after the birthday month. Reason D is not correct. This choice is wrong because the period extends for 3 months after the birthday month, not 6. Question 5. Which statement accurately describes the timing of the annual general enrollment period for Medicare Part B and the calculation of the late enrollment penalty? A. It runs January 1st through March 31st each year, with coverage effective July 1st, and the penalty is 10% for each full 12-month period without creditable Part B coverage. B. It runs April 1st through June 30th each year, with coverage effective January 1st, and the penalty is 1% for each month without creditable coverage. C. It runs July 1st through September 30th each year, with coverage effective January 1st, and the penalty is 10% for each full 12-month period without creditable coverage. D. It runs October 15th through December 7th each year, with coverage effective January 1st, and the penalty is a one-time 10% charge upon enrollment. The correct answer is A. The correct answer is that the general enrollment period for Part B runs January 1st through March 31st, with coverage effective July 1st, and the penalty is 10% for each full 12-month period without creditable Part B coverage. Reason B is not correct. This option is incorrect because both the enrollment window and the penalty rate differ from federal rules. Reason C is not correct. This statement is wrong since the specified months do not match the actual January-March window. Reason D is not correct. This choice is inaccurate because the general enrollment period does not occur in October-December, and the penalty is not one time. Question 6. Carlos retires on June 15, 2023, and his employer group health plan ends on July 31, 2023. He deferred enrolling in Medicare Part B while covered under that plan and calls Medicare on October 1, 2023. Under the special enrollment period for active employment coverage, how much time does Carlos have remaining to enroll in Part B to avoid a late enrollment penalty? A. 2 months remaining, ending December 31, 2023. B. 6 months remaining, ending March 31, 2024. C. 8 months remaining, ending March 31, 2024. D. 10 months remaining, ending May 31, 2024. The correct answer is B. Carlos's special enrollment period runs for 8 months from the date his employer coverage ends, July 31st, 2023. So, on October 1st, he has 6 months left before it closes on March 31st, 2024. Reason A is not correct. A 2-month window understates the remaining enrollment time, which actually spans 8 months total from coverage end. Reason C is not correct. An 8-month remaining period ignores that nearly 2 of those months have already passed by October 1st. Reason D is not correct. A 10-month window overstates the special enrollment period, which never exceeds 8 months after coverage ends. Question 7. Which column on a Medicare summary notice indicates the combined total of beneficiary coinsurance, deductible, and any late enrollment penalty that Medicare will bill to the beneficiary? A. Provider bill charges. B. Medicare approved amount. C. Program deductible amount. D. Patient responsibility. The correct answer is D. The patient responsibility column shows the total amount the beneficiary owes after Medicare processes the claim, including coinsurance, deductible, and any late enrollment penalties. Reason A is not correct. This reflects the provider's initial charges before Medicare applies any adjustments, not the amount owed by the beneficiary. Reason B is not correct. This shows the amount Medicare approves to pay the provider before any beneficiary cost sharing, not the amount billed to the beneficiary. Reason C is not correct. This represents only the deductible portion and does not include coinsurance or penalty amounts. Question 8. Ms. Rodriguez receives 2 outpatient services under Medicare. Part B, an evaluation and management visit, CPT 99213, where the physician accepts assignment, and an outpatient therapy service, CPT 97110, performed by a provider who does not accept assignment and charges 12% over the Medicare-approved fee. The approved charges are $120 for CPT 99213 and $80 for CPT 97119. Ms. Rodriguez has met her Part B deductible and Medicare covers 80% of approved charges. What is her total out-of-pocket liability for both services? A. $24. B. $49.60. C. $40. D. $56.80. The correct answer is B. The correct answer is $49.60 because the E divided by M visit assignment acceptance limits liability to 20% of $120, $24, and for the non-assigned therapy, liability includes 20% of $80, $16, plus a 12% excess charge on $80, $9.60, summing to $49.60. Reason A is not correct. This calculation only includes coinsurance for the E divided by M visit and omits any liability for the non-assigned therapy service. Reason C is not correct. This option includes coinsurance for both services, but fails to account for the additional excess charge on the non-assigned therapy. Reason D is not correct. This amount reflects coinsurance on billed rates rather than approved charges and does not correctly apply the excess charge calculation. Question 9. Which of the following best defines a Medicare Part A benefit period for inpatient hospital coverage? A. Covers inpatient services only within a calendar year, ending on December 31st each year. B. Begins on the date of inpatient admission and continues for a fixed 90-day episode regardless of any gap in care. C. Begins on the date of inpatient admission and ends after 60 consecutive days without any inpatient or skilled nursing facility services following discharge. D. Extends until the enrollee exhausts 60 lifetime reserve days for inpatient care. The correct answer is C. The correct answer is that a benefit period starts upon admission and ends when the beneficiary has had 60 consecutive days without inpatient or skilled facility services, as defined in Medicare regulations. Reason A is not correct. This implies a calendar year basis, which does not align with Medicare's benefit period definition. Reason B is not correct. This describes a fixed 90-day episode rather than the regulation's 60-day gap criterion. Reason D is not correct. This confuses benefit periods with lifetime reserve days, a separate policy provision. Question 10. As of 2021, what is the standard Medicare Part A deductible that a beneficiary must pay for each inpatient hospital benefit period? A. $1,340. B. $1,556. C. $1,484. D. $1,226. The correct answer is C. The correct deductible amount for each inpatient benefit period in 2021 is $1,484, as updated annually by CMS. Reason A is not correct. This figure does not match any recent Medicare Part A deductible. Reason B is not correct. This reflects the 2022 deductible amount rather than the 2021 rate. Reason D is not correct. This lower amount underestimates the 2021 standard deductible requirement. Question 11. After using 60 days of Medicare Part A inpatient hospital benefits in a single benefit period, a beneficiary remains hospitalized and is now on day 75. What coinsurance amount applies to each inpatient day from day 61 through day 90 of that benefit period? A. No coinsurance is charged for days 61 through 90. B. 20% of the Medicare-approved amount for each day. C. $400 per day. D. $800 per day. The correct answer is C. The correct answer is $400 per day because Medicare Part A requires a daily coinsurance payment for days 61 through 90 of a benefit period at a fixed daily rate rather than a percentage or full cost coverage. Reason A is not correct. No coinsurance only applies for the first 60 days, not days 61 through 90. Reason B is not correct. Medicare Part A uses a fixed daily coinsurance amount for days 61 through 90, not a percentage of charges. Reason D is not correct. The $800 rate represents lifetime reserve day coinsurance, not days 61 through 90. Question 12. A beneficiary is hospitalized for 110 days during one benefit period. After day 90, 10 lifetime reserve days are used. How many lifetime reserve days remain available for future hospital stays across all benefit periods? A. 0 days. B. Unlimited days. C. 10 days. D. 50 days. The correct answer is D. The correct answer is 50 days because beneficiaries have a total of 60 lifetime reserve days and have already used 10, leaving 50 for any future benefit period. Reason A is not correct. All lifetime reserve days are not used after only 10. 50 remain. Reason B is not correct. Lifetime reserve days are capped at 60 total. They are not unlimited. Reason C is not correct. 10 days is the number already used, not what remains. Question 13. Under Medicare, Part A coverage rules, which inpatient hospital stay requirement must be satisfied before skilled nursing facility services will be covered? A. A cumulative 72-hour stay including observation days counted as inpatient days. B. At least 3 consecutive nights spent as an inpatient with each midnight counted toward the requirement. C. Admission for at least 4 midnights in either inpatient or observation status. D. A minimum of 3 calendar days including the day of admission and the day of discharge. The correct answer is B. The correct answer is that Medicare requires a beneficiary to have at least 3 consecutive nights spent as an inpatient, with each midnight counted before skilled nursing facility services are covered under Part A. Observation days and discharge days are not counted toward this requirement. Reason A is not correct. That option is incorrect because observation status days do not count as inpatient days toward the 3-night requirement. Reason C is not correct. That option is incorrect because Medicare requires 3 consecutive midnights, not 4, and observation status is excluded. Reason D is not correct. That option is incorrect because discharge days are not counted and the requirement is defined by midnights, not calendar days. Question 14. Medicare. Part A covers skilled nursing facility care only if daily skilled nursing or therapy is medically necessary. Which standard defines daily skilled under these rules? A. Medically necessary skilled nursing or therapy services requiring professional skill on a daily basis. B. Care provided for at least 5 consecutive days per week under direct physician supervision. C. Services requiring complex nursing procedures that could only be safely performed by a licensed nurse or therapist at least once per week. D. Custodial assistance with activities of daily living when ordered by a physician. The correct answer is A. The correct answer is that Medicare defines daily skilled as medically necessary nursing or therapy services requiring the skills of a licensed professional that must be provided each day. Custodial care and less frequent services do not meet this standard. Reason B is not correct. That option is incorrect because direct physician supervision is not required for each day, and frequency is misrepresented. Reason C is not correct. That option is incorrect because weekly frequency does not satisfy the requirement for daily skilled services. Reason D is not correct. That option is incorrect because custodial assistance is not considered skilled nursing or therapy under Medicare rules. Question 15. Mary, covered by Medicare Part A, entered a skilled nursing facility for post-surgical rehabilitation. After using up the first 20 benefit days, she is now on day 45 of her current benefit period, which best describes her coinsurance responsibility for skilled nursing facility care during days 21 through 100. A. Pay 20% of the Medicare-approved charge for each day from day 21 through day 100. B. Pay a fixed daily coinsurance amount of $200 for each day from day 21 through day 100 of the benefit period. C. Pay nothing for skilled care days up to day 100, once the first 20 days have been used. D. Pay the full cost of all skilled nursing facility services until the benefit period resets. The correct answer is B. The correct answer is that beneficiaries owe a fixed per-day coinsurance for days 21 through 100 of skilled nursing facility care under Medicare Part A. This daily coinsurance amount applies after the first 20 days of each benefit period and before day 101. Neither a percentage of charges nor full cost payment applies during this interval, and coverage is not free once the first 20 days are used. Reason A is not correct. Medicare Part A does not use a percentage of charge coinsurance for skilled nursing facility days 21 through 100. It uses a fixed daily amount instead. Reason C is not correct. Coverage is not free after the first 20 days. A daily coinsurance applies from days 21 through 100. Reason D is not correct. Beneficiaries do not pay full cost until after day 100. Days 21 through 100 have a set daily coinsurance. Question 16. Under Medicare. Part A's home health benefit, intermittent skilled nursing care is limited to which of the following maximums? A. No more than 6 hours per day and 28 hours per week. B. No more than 8 hours per day and 40 hours per week. C. No more than 8 hours per day and 35 hours per week, excluding therapy services. D. No more than 8 hours per day and 28 hours per week. The correct answer is D. The correct answer is based on Medicare's definition of intermittent skilled nursing, which is generally limited to no more than 8 hours in a single day and 28 hours across any 7-day period. Reason A is not correct. That choice understates the daily limit by restricting to only 6 hours, whereas Medicare allows up to 8 hours per day. Reason B is not correct. That choice overstates the weekly maximum, as the policy caps weekly hours at 28, not 40. Reason C is not correct. That choice misstates the weekly limit and introduces an exclusion not found in the standard intermittent nursing definition. Question 17. Which of the following best describes the homebound status requirement for Medicare home health eligibility? A. The beneficiary must be unable to leave home without assistance, and leaving home must require substantial and taxing effort. B. The beneficiary can leave home daily for essential medical treatment without losing homebound status. C. Occasional absences for religious services are not permissible and result in ineligibility. D. Being confined to home except for visits with family members satisfies the requirement. The correct answer is A. The correct answer reflects Medicare's requirement that homebound status be defined by the beneficiary's need for assistance and the effort required to leave home. Reason B is not correct. This choice inaccurately implies daily medical outings are allowed without affecting homebound status, but the focus is on substantial effort to leave. Reason C is not correct. This choice incorrectly states that any religious outing disqualifies homebound status, whereas brief and infrequent absences for religious services are allowed. Reason D is not correct. This choice overemphasizes family visits. Eligibility centers on medical and functional barriers, not social visits. Question 18. A 78-year-old beneficiary covered under Medicare Part A is discharged home after a hip fracture hospitalization. The attending physician certifies home health services and orders physical therapy, occupational therapy, and speech therapy. After 20 physical therapy visits and 10 occupational therapy visits, the home health agency notifies the beneficiary of potential limits on therapy coverage. Under the Medicare Part A home health benefit, which statement best describes coverage limits for therapy services? A. Physical therapy visits are capped at 35 visits per spell of illness. B. There is no specific visit limit for therapy services as long as they remain medically necessary and are included in the plan of care. C. Therapy services are covered only for a maximum of 8 weeks per benefit period. D. Speech therapy is covered only when provided concurrently with occupational therapy sessions. The correct answer is B. The correct answer is that therapy services under the Part A home health benefit are covered without a preset numerical limit, as long as each discipline remains medically necessary and is documented in the physician's certified plan of care. Reason A is not correct. There is no defined cap of 35 visits for physical therapy. Care continues based on medical necessity. Reason C is not correct. Coverage is not limited to 8 weeks. Duration is tied to medical necessity rather than a fixed time frame. Reason D is not correct. Speech therapy does not require concurrent occupational therapy to be covered under home health. Question 19. Under Medicare Part B, which of the following physician-administered drugs provided in an outpatient setting is covered? A. Oral antiemetic medication following chemotherapy. B. Inhalation therapy for asthma via a home nebulizer. C. Self-administered insulin for a diabetic patient. D. Intravenous immunosuppressive therapy following organ transplant. The correct answer is D. Intravenous immunosuppressive therapy following an organ transplant is covered under Medicare Part B when administered in an outpatient setting. Reason A is not correct. Oral antiemetic medications are generally covered under Medicare Part D rather than Part B. Reason B is not correct. Inhalation therapy via a home nebulizer is treated as durable medical equipment, or under Part D respiratory drug benefits, not Part B physician-administered drugs. Reason C is not correct. Self-administered insulin is covered under Medicare Part D, not as a physician-administered drug under Part B. Question 20. Under Medicare Part B, which of the following laboratory tests is covered as a preventive service in an outpatient setting without patient cost sharing? A. Fasting lipid panel for cardiovascular risk screening. B. Hemoglobin A1C test for patients with known diabetes. C. Fasting blood glucose test for monitoring diabetes control. D. H. pylori stool antigen test for suspected infection. The correct answer is A. A fasting lipid panel for cardiovascular risk screening is covered as a preventive service under Medicare Part B without deductible or coinsurance. Reason B is not correct. Hemoglobin A1C tests are used for ongoing diabetes management and are subject to deductible and coinsurance. Reason C is not correct. Fasting blood glucose tests for diabetes management are diagnostic services subject to cost sharing under Part B. Reason D is not correct. H. pylori stool antigen tests are diagnostic and do not qualify as preventive under Part B. Enjoyed this practice test? Tap like, hit subscribe, and share it with a classmate. Got a question we should tweak? Comment below. We read them all. Find full practice exam books in the description or at ExamPrep.School.